So I'm here today with Ashley. She's one of our nutrition educators and lifestyle educators in the Healthy Steps Lifestyle Center, and we're reviewing this paper, Primary Prevention of Cardiovascular Disease with a Mediterranean Diet. This is a big deal. It reinforces a lot of what we already know, but this is finally getting the word out to the lay press. So the Wall Street Journal picked this up, locally the Press Dem picked it up, and it's a study out of Spain that compared various diets, including two Mediterranean diets against a standard sort of low healthy fat kind of diet. They had almost 7,500 patients, and there were three groups. So in one group, they had them eating a modified Mediterranean food plan, and they added olive oil. In the other group, they had that same modified Mediterranean eating plan, only they added nuts. And in the third group, they had a counseling and a fairly intensive general good nutrition plan that didn't really stress fats or not, but it's kind of generally a low-fat diet. And they followed them out, and they asked the question of this: is there any difference between stroke and heart attack in these groups? And the answer was really quite surprising. The original plan was to follow the patients out for 6 years, but they had to stop the study 4 years into it because it was no longer ethical to eat the other way. The incidence of heart attack and stroke was cut by more than 30%, and the ethics committee felt like they could no longer allow the control group to not eat with the modified Mediterranean eating. Speaking of that, you do a lot of patient counseling on what is this modified Mediterranean eating. So what did you find in this?
What I found was very interesting when looking at what they were feeding their patients during the study. It mimics very, very closely to what we do here at Healthy Steps. So we're talking lean protein, so fish, poultry items, lots and lots of fresh fruits and vegetables. Like Dr. Woodbury said, some nuts and seeds and olive oil. But very, very close to what we do here at Healthy Steps, which isn't in the Mediterranean, but very close in contrast. So we're very, very fortunate that we have all kinds of fresh fruits and vegetables readily available to us here.
So 30 grams of nuts, how are you going to tell a patient? Do they have a scale? Or
right.
What?
So we try to make it as easy for our patients when they're out in the real world, because no one is going to carry a scale around with them forever. I mean, some patients have their leftover Weight Watchers scale from years ago, but we go off of the hand method. So 3 fingers for your nuts and seeds and fats, a palm size right in your palm for your poultry and meat and what have you, and then a nice big handful for your vegetables. So that's just kind of the easy go-to when you're out and about. You have your hand always available.
You always have your hand available.
You always have your hand available.
So this is exciting news, and it's one more piece in the scientific literature about what works.
Well, and I like what you were hitting on earlier of not only are we looking for weight loss, but just general health. You know, I mean, this diet it's not only going to help keep you thin, but it's going to really, really target those key things that everyone's getting so sick from by eating that standard American diet.
Right. So, for weight loss, but also wellness and cardiovascular health, I think we're on to something. More to come.